Welcome to the Growth Lab, the podcast dedicated to the business of beauty and vitality. Today, we are sitting down with Dr. Kenneth Krieger, the senior partner and trainer of Bioscan Medical Technologies. It's an amazing product that he has that measures cellular health. Let's find out more. This episode is brought to you by MedSpa Accelerator. We help medical practices and med spa clinics solve the bottleneck of inconsistent, unqualified sales using AI to achieve a predictable, scalable monthly revenue without staff burnout. We're absolutely thrilled to have Kenneth join us to discuss the future of patient care and these unique tests. Let's get started. Good afternoon, Kenneth. How are you?
Jason, I'm great. Thank you.
All right. Well, I'm excited to dive into your story, Kenneth. I like to frame these conversations simply past, present, and future. I want to start with your origin story, how you got into this demanding yet rewarding industry. And then we'll pivot over to the present reality of what's working, what's causing friction, what's keeping your doors open. And then finally, we'll look at the future outlook, your vision for the next 3 to 5 years, and the biggest strategic moves that you're planning. We will be able to cover a full spectrum of building out a successful business. Does that sound like a good roadmap?
I'm on board.
All right, fantastic. Well, it looks like that you or New Skin developed the Prism cardioid measuring device about 3 years ago. Is that right?
Well, actually, the original device was developed through a grant from the National Institutes of Health with the University of Utah. They were scanning the eyes of age-related macular degeneration patients with an argon laser. It was about the size of an MRI machine. And we purchased from PharmaNex, we purchased the global patent rights from them. And we've done the research and development on the device now, which has gone through 4 different phases. And now, obviously, it's this size after $500 million of investment and research and development. And
Wow.
its accuracy is very amazing, non-invasively and in 15 seconds, and more accurate than blood, as accurate as tissue biopsy. And that's why I started doing this.
Okay. And what gave you the inspiration to join New Skin? Because New Skin is known as a nutritional MLM company, right?
That's the parent company, but the health and wellness side is an entity on its own. And we do all of the research data, and we gather the data from, we purchased a DNA AI company about 20 years ago, and we have more genetic expression codes on file. It's called LifeGen Technologies. And we own all of that data now. We have hundreds of millions of data points on genetic expression, and we have nearly 30 million scans, and we put the analytics together, and that's why we can come up with the score, if you will, of the biomarker for nutritional absorption at the cell. And that's the differentiation that we see. Most people have no idea if they're absorbing their nutrients at a cellular level. And it's not about how
Okay.
we feel, it's about how we function.
Makes sense. And what gave you the inspiration to come on board? Did you take a tour or did you kind of what got you involved with this?
A great question. I was using heavy amounts of nutrition and essential oils in my spinal trauma, spinal rehab practice. And I retired 20 years ago, and I wanted to continue helping people. I taught for the essential oil company all over the world. I was a global teaching physician. And then when the developer of that company and the CEO of a genius in his own right passed away suddenly, he and I were the same age. It was just not the same for me. And I kept looking for something that I could do to continue to help people. Because as you know, people don't really care how much you know or was, because I was taking $300 a month in supplements
Yeah,
and 4 professional lines that I was told were the best you could buy. You know, you've heard that. And I had a
I have heard that.
yeah, I had a failing score. And that's what
Mm,
prompted me to go with this application, because we're the only company in the world that guarantees performance, improving the cellular wellness score, the biomarker score, in 60 days, or you get your money back. So,
really?
yeah, over 120 peer-reviewed studies are listed in the physician's desk reference. First nutrition company to be allowed to use the product for the U.S. Olympic team in the last 3 Olympic Games. They pass everything from banned substance control. I can go on and on. No one does the testing the way we do at 1 part per 50 billion, for instance. And that's more of the scientific element, but that's what prompted me to join with this because there's nothing else like it in the world.
Yeah.
First is the lousy food that we have. When I grew up in Colorado, we had a half-acre garden, and it was amazing. Food tasted like real food, and we had our own fruit trees my mother would can. But I dare anybody to cut into a tomato now and tell me it tastes like a tomato because they don't. They don't have the nutritive value anymore. So one of our 80 full-time scientists on staff gave me an idea that so much vitamin C was in an orange around 1950. You'd have to eat between 20 and 25 now to get that same value because they're not ripened on the tree and the soils have been depleted. So how is a person supposed to get everything that they need through their diet alone? There has to be something that fills the gap between what they do absorb and what their body requires to be healthy. And that has to be filled with something. Genetics will play a part. Some people absorb better than others, but predominantly, most people can't get enough out of their diet.
Now, why is a money back guarantee so unusual in this space?
Well, first of all, no one has a biomarker that they can start out with to find out how that biomarker is going to shift and improve their score. For
Mhm.
instance, if you went into the doctor and the doctor just looked at you and said, well, Jason, looks like you have high blood pressure. I'm going to put you on blood pressure medication, but doesn't test you. I mean, it's silly. The same thing is done all the time with nutrition. They don't have a baseline score to go by. Is it really working? And how does a person know? And remember, it's not about how you feel, it's about optimal function. That's the key. So when that score raises, that means you're absorbing more antioxidants and the carotenoids. We test 18 carotenoids right now. With 18 additional biomarkers coming, they're going through the patenting process. And I understand the next one will be on collagen absorption, which is huge. We have the only collagen that has a scientific study to back the idea that it actually works. No one else has that. So those are the types of things that prompted me to do this. I wanted to have a company that has the research data behind it and the proof that it actually works. And we're listed on the New York Stock Exchange, 5A1 rating, the highest you can have. Only Microsoft, Coca-Cola, and Walmart have that same 5A1 rating by Dun& Bradstreet, and us. That's it. So we're not going
Yeah.
anywhere. Been in business 43 years, never had a recall, never lost our 5A1 rating.
Right. Okay. Mhm. Correct.
Exactly. Yes.
Okay.
Yes. The
All right.
three men that
Fantastic.
started,
Is that going to be implemented into the Prism device and test for those new ones? Scale?
they are going to be integrated into the device and the test itself. The scale will change here and there because of more analytics. The more information we have on gene expression codes and the more scans that we do, it will change the actual score levels or analytics as time goes on because we'll have more data and we're getting this data continually. And that's what is separating us from everyone else. They don't have the data that we have. They don't have the scanner and they don't have the scientists that formulate. And that's why I just can't say enough about what is done not only for me, but for those people that I've scanned.
Yeah.
Well, on the prism itself, it has zones and you can see the various colors. And then you can see the device. The scan actually comes through the index finger in the middle of the device. And this is a demo device. This isn't the one that I use. But in 15 seconds, it will give you a scale, if you will, or a color or a zone that we're in. And the
Mhm.
zone will tell you how well you're absorbing. And you can see where I'm at in the zone. So I'm in the purple, which is the highest zone you can be in. This is the demo device, but my scan score was a failing score in the beginning. I went on one of the products that we have, one of the 80 products, and we have scanner approved products that guarantee to raise the score. I nearly doubled my score in 30 days. And at the end of the 5th month, I was in the blue zone or where we want to see a person. It's literally changed our lives. My wife and I have been married 50 years. We eat the same foods. She started with a D score, if you will, and she scores A plus now. She beats me all the time because she sleeps better than I do. She sleeps like a
Oh.
log. And when people don't sleep well, they're not going to have as good of a score. That's really a very viable way to help a person shift their lifestyle because sleep is necessary for cellular regeneration and get the mitochondria to fire off like they're supposed to, the little engines of the cell.
Okay. Now, I want to know a little bit more about the recommendations that the app makes based on the score that comes in from the scan.
Yes, and it depends on a person's age and what their scan score is. The lower the score, the more they need with nutritional shift in order to raise that score. So they're going to be on a different product than someone who scans, let's say, we want to see 550 or more. And I know that scale doesn't mean anything to people, but it starts at 100, goes all the way to 1200. And the average American scans about 240. And when we see that person, they are going to be on more product or additional product than the person who scans maybe at 500, because we're going to get them over that 550 mark with less product, if you will, because they're absorbing fairly well at the time, but that absorption will be even greater because of what we're going to recommend to them. We have over 80 products from cradle to geriatrics. We have something for everyone from $1 a day on up. I mean, there is something that a person can take in order to improve their scan score.
Wow, that's great. And what products are you currently on right now, Dr. Krieger?
Well, again, everyone's a bit different. I'm on one of our products called LifePak Nano. It has everything in it, including the equivalency of 8 to 10 servings of fruits and vegetables. It's on what I like to call a supercharger. It's a fish oil nano product that we get the fish from off of the Antarctic coast, where the cleanest ocean water is. And we use a lot of anchovies and mackerel because they're smaller fish. The larger fish have more susceptibility for microtoxins, and we don't let it sit on the shelf in a warehouse for a month in a 55-gallon drum. We turn it over as soon as possible and get it into the product and get it out to the public right away, because it helps drive the rest of that, the nutrition in the LifePak Nano to the cell. When you think about it, the fat substances need a bit of fat or food when you take the product in order for its greatest absorption. And then the other product I take is called AgeLock Youth. It's a nanotechnology product that was developed over a 7-year study. And the AgeLock means that we can literally see the shift in the genetic expression code card if a person has their genetic expression code actually tested, where we can see a shift from aged back to youth. And it's amazing to find out myself when I saw my scan score improve, and when I was not taking that product, it improved slower. That product has really helped change things for me. And I know it's anecdotal, but my wife is on the same thing. She doesn't take the nano, she takes the regular LifePak, and she always beats me. And it's kind of a contest that we have. And what's really amazing, I'm 77 years old. I've been on product about 3 years and 8 months, and since I started on product, I haven't been ill one day. I know that's anecdotal, it's not scientific, but you can't take that testimony away from me. And my wife's the same thing. You know, we've been married 50 years. You get to know that person like nobody else in the world, and it's changed our lives. And, you know, we have our health and wellness because of it. And I think you have to agree, our most important earthly possession is our health. Without our health, we have nothing.
Yeah,
Ask
I
Steve
agree.
Jobs if he get his billions back to come back healthy. I bet he would. You know, his billions
Mm,
didn't save him. So,
yeah, that's a really good comparison. Uh, and thanks for sharing that with me. Works, is that right?
yes, yes.
Are they really going to feel a marketable difference after just 1 month?
Well, obviously, it depends on the person because all our genetics are different. Some people feel a remarkable difference in a week, even sometimes in a few days. And
Okay.
other people, it does take longer for absorption to get to the center of the cell. And that's why we tell a person, give it at least 60 days. Take product for 2 months. See what your scan score is then compared to the initial scan score. And we have found that 99% of the people that we place on product improve. That's a pretty remarkable statement. And I
Wow.
have scanned many, many people, and I've never had to give a person their money back. They've all improved, some small amounts and some great amounts. So it just depends upon the person's genetic structure and how well they're going to absorb, because we're all a bit different.
Okay. Yeah, that makes a lot of sense. Now, in terms of your goals for biomedical technology, what is the biggest goal of the business in 2026?
Well, and remember, it is Bioscan Med Technologies.
Okay, thank you.
And my goal for my team, and we do this as a team concept, we want people to understand why the products work the way they do, how to educate people about their health and wellness. And we
Mhm.
do this as a team. I do the training. My team helps others with training also. And my goal for my personal team is to place 250 of these devices before the end of the year. And the revenue stream that it can create for a med spa or a physician when they have 100 people on product, it can create a revenue stream in cash between $35,000 and $70,000 a year. Now, why is that? Because it depends on what products a person is taking and how long they're going to be on that product. But we've found that over 62% of the people that get scanned the second time stay on product. And that's remarkable because if someone buys something online, it's between 4 and 8% at the most that a person will stay on that product. So the baseline score is the most important thing. Find out if you're absorbing, find out where you are, and then see what the improvement is after 60 days. And the proof is in the pudding, as they say.
Okay. Great. Thanks so much. You were mentioning earlier before we started recording, you said that you got a NFL player that recently linked up with you.
Yes, retired NFL player, and I used to play for the Arizona Cardinals. Great guy. And there is a certain product line, I won't mention it, that the NFL players can purchase with a discount. And there are many people that I have scanned that were on that product that did not scan well. I was
Mm.
on that very product line when I was scanned. And so when he saw that there is an available way to see what improvement is made by having an actual baseline score and seeing the differentiation, that's why he decided that he came on board. And he wants to promote this because he said for the first time, and think about this, for the first time in living human tissue, we have a real-time biomarker score that you can go by. Never been accomplished before. And the technology was originally with this device called a biophotonic scanner, and you'd scan through the palm of the hand. And you had to lease this thing for $150 a month. You couldn't buy it. It would cost $25,000 or $30,000. It has 4 resonance Raman spectroscopy tubes in it. And the new device is Raman spectroscopy. And it's a light that will make the carotenoids right now vibrate, and it changes the color with 70,000 lights going off per second. And then the computer reads it in this device and sends the score to your iPhone. It's pretty remarkable in itself. So no lease required. You can purchase a device for $299. It's not a medical device. It's a measurement tool like a blood pressure cup would be. And we can teach the med spa or the physician or the day spa a return on investment within a couple of days. And that's remarkable when they're spending thousands and thousands of dollars for aesthetic equipment or red light therapy, that type of thing. Or this is something that a person can see an instantaneous real-time score. And for the first time, the client or the patient will go, wow, you can prove it to me, whether this is working or not. So that's what differentiates us.
Wow. That's pretty amazing. So it sounds like it's a really great tool, but like you said, it's not a medical device.
Mhm.
Hmm.
That's why a person can
And
own one if they choose to, and then they can monitor themselves at home. My
mhm.
Apple Watch costs $500. What does it do? It told me I didn't sleep well last night. I already knew that. And gives me my heart rate, how many steps I've done in a day, how many calories I've burned. And that's important. That's good. But it doesn't give you any nutritional biomarker. And that's the differentiation where a person can have one of these at home. And they can monitor their own lifestyle and the lifestyle of their family and shift things around. Have those kids eat more fruits and vegetables. Have your diet shift, which is important. I'm not discounting that, but if you think about it, we don't have healthcare in this country. We have managed disease care, and it's not proactive at all. It's always reactive. And we
Mhm.
want to be proactive to prevent things from happening. It's easier to keep a person well than it is to get them well.
Okay. Yeah, I will completely agree. And full disclosure, I have met up with Dr. Krieger a few days ago, and I have my own Prism device. I've been scanning myself every single day, and gradually my score has been improving thanks to the tablets and also the supplements that I've been taking. So it's really nice to see that. But on the other side of the coin, I do like the financial aspect that you mentioned as well, because it can be a revenue generating device for medical practices, which, as you know, is the audience that we speak to on this podcast. So they can purchase this for, and this is probably going to be the least expensive a piece of medical equipment that you'd ever purchase for your med spa. And then you can actually go per patient per scan. And then, if they choose to, put their trust and everything in the device and actually get on product, then that medical spa or physician's office is actually going to generate revenue.
Well, let's look at it from this point of view again. I had mentioned that earlier. When they're on 100 people are on product, it will generate between $35 and $70,000 of extra income for that the facility or that practice. But that's not
Right.
including charging for the scan, because there should be a value placed upon what this does, because there's nothing else like it. So let's say they would charge that client or that patient $20 for a scan, which is very reasonable when it comes to any type of testing nowadays. Look what blood tests cost. I mean, it's skyrocketing. But if they only scan 5 people a day and it's $20 a scan, 5 days a week, that's a $25,000 cash revenue. And they haven't even placed people on product. And it's on a $299 investment. I mean, I hate to use the terminology, and I think I mentioned this to Jason when we had previously talked. It's really true. It's a no-brainer. It just
Yeah.
makes so much sense. But then when they place people on top of that on product, they get a certain percentage back from placing that patient or that client on product. So let's say they have 200 people on product. How about $70,000 to $125,000 a year? And it can go on up. The average medical doctor in this country has between 4,000 and 5,000 patients on the book. So to have 100 people on product is very reasonable to do. If it's 50 people, then it's half as much. But on a $299 investment, the other thing that it will produce, referrals, because all of a sudden mom comes in, she gets scanned, and she said, well, do you scan children? Well, absolutely. And everyone in their family should know their score. That's what I tell people. Know your score. Know your biomarker score. And that changes everything for everyone.
Yeah. You came out of retirement for this, Dr. Krieger. Why is it that you're more excited and fired up now more than ever?
I was placed upon this planet to help people. And it comes back to the old adage, people don't really care how much you know. They just want to know how much you care. And when my mother lived to be 100, and she was very viable, living in her own home, cooking her own meals. She was amazing. I want everyone to be healthy up until the day they die, rather than the average American is sick 12 years prior to death. We're number one in the world in that instance. So why not have your lifetime healthy and think about wellness up until the day that you die? And that's my goal. At 77, if I live to be 100, I only have 23 years left. Who knows what tomorrow will bring, but I'm going to be as healthy as I possibly can. I'm going to be a walking, living example of what health and wellness is. Because if I don't take product and I don't tell people what's happened with me, with this device and with the supplement therapies, then I'm a hypocrite. And that's why we want people to understand about their health and wellness. People are looking for it now. They're tired of the system because our system is broken. I mean, look at the obesity
Agreed.
rates, and diabetes is going off the charts. Cancer is going off the charts. And those low scores will show up when people are in that type of health environment, if you will. Smokers, they have terrible scores because of oxidative stress, and people who drink a lot of alcohol, their score will reduce because of that. It's an oxidative stressor. I'm not saying you can't drink alcohol, but it is going to be affecting your score over a period of time. If you have a glass of wine every day, it's never going to hurt you, probably help you, because it's good for regulation of the blood pressure in certain instances. And we know that red wine will help reduce cardiac death rates. It's pretty interesting if you look it up. But too much is we want people to think on the terms of everything in moderation, and it probably won't hurt you. But why do things in moderation that could possibly hurt you when you have the availability of the great aspect of being proactive for your health? That's everything to me.
Yeah. Well, that is a fantastic breakdown, Dr. Krieger. And thank you for being so candid about the operational reality, what more about the prison device itself. If you want to get more information, we're going to leave a link in the description down below, and it's biotechnologies.com. And we're going to bioscan technology. Yeah, yeah, we're going to leave a link for it down below.
email
That's
me
correct.
directly and I'll answer any questions. Dr. K
Okay.
at bioscanmedtechnologies.com. Real simple.
Fantastic.
Okay.
I think we've covered a lot of ground today, Dr. Krieger, from your origin story to the future of aesthetic medicine. And I know that our audience is going to get immense helpful benefit from this. And hopefully, they'll contact you and get scanned and get more information, or just go to the website because it's chock full of great information on your website. So with that, we're going to go ahead and wrap up the recorded portion of the Growth Lab. And thank you so much for stopping by.